It's Organ Donor Enrollment Day. Have you registered?
I think that's really what's important, is to make sure that we're conscious of the choice we can make.
To tell you why this small step can have a big impact, your host, New York State Senator David Carlucci.
Thank you for joining me today, and please tell me about Dream and the condition that she's had, and when you first knew about it, and where that led you.
So Dream was born with sickle cell disease. I found out that Dream had sickle cell when she was in utero. I did a test that they call an amniocentesis test when I was pregnant, and discovered that because I was a carrier of the sickle cell trait, and so was her father, that there was a 1 in 4 chance of her having sickle cell disease. And basically what sickle cell disease is that we have round, red, flexible blood cells, but those who are born with sickle cell disease have that as well, but they also create cells that are shaped like a C, hence the sickle, crescent moon shape, and they're hard, which makes it difficult to go through the veins and can cause what they call blood clots anywhere in the body. So I always say sickle cell disease is an invisible disease because people can't see it on the surface. And it's also, to me, a game of Russian roulette because you never know when it can be triggered. So she ended up then having a stroke at 5 because of having a sickle cell crisis.
So she's 5 years old. She was in kindergarten at the time.
Yes.
When she had this stroke. And then what came next in terms of eventually having the stem cell transplant?
So after going through an event like that, and then being a young mom and then learning even more about the condition, and then obviously made me more hyper alert about her. We started to do a lot of advocacy. We started to, reach out to different hospitals and just trying to get the messaging out there. And Dream actually ended up becoming the Grand Marshal for Maria Ferreri's 10th annual Go the Distance walk. And we were, on a tour promoting that. And in that process, I had spoke at their donors dinner. And that's when we met a hematologist there that then presented the opportunity for us to participate in a haploidentical stem cell transplant, which in layman terms is basically a half-match stem cell transplant, meaning I would be her donor as a mom, as 50%, of her gene carrier. Okay. So with that, we said, obviously, this is our only chance to be able to cure her. If she got a fever, we would have to stay in the hospital for 3 or 4 days, or, just closely monitor her to make sure, there wasn't anything else going on. The reason why it slowed down when she had the stroke is because then she had what they call a portacath place, so they can always access her immediately, and was put on monthly blood transfusions. So would have to go every month to outpatient to get a blood transfusion. And that would just support her body by giving her more healthy red blood cells than sickle cells. So that kept her pretty much, routinely and regular, for the most part.
It seemed like a breakthrough in modern medicine in terms of this ability to do and have the complete remission of sickle cell, something that I hadn't heard of before. And maybe you could talk just a little bit about that.
Yeah. People are doing it more and more. And I get stories from people randomly across the country, or people will send me stuff, and I do see it's still very much in clinical trial.
Okay.
So there are different facilities practicing different methods of how they are going about doing it. You know, some people, like I said, use the half match process. I think ultimately, as you know, the name of this game is the insurance companies have to buy into it. They have
Right.
to then say this is going to be standard of care, because
Mhm.
ultimately what's going to happen is they're going to look at a sickle cell patient's lifespan and the amount of money or that is spent over their lifespan by just trying to keep them healthy versus
Mhm.
what it would take to do a transplant that can ultimately, you know, give them the freedom of health for, the rest of their life. And, it's
Right.
going to come to dollars and cents.
Mhm.
Sadly, that's how it works in the country we live in, but that's, what it is. It's not standard of care yet.
There has been breakthroughs in modern medicine and new technology, but if the insurance companies aren't covering it, if there's not access, and if the innovation doesn't continue, then we have a huge problem.
Right.
Maybe you could tell us a little bit about the problem that you ran into after the transplant and how Dream's Law came to be.
Okay. So, with doing a lot of research about transplant and learning, what it was going to require and what it would take for us as a family to get through and for her to recover, I actually I asked to speak to other families that went through similar process to get some understanding and lay of the land of what I was really walking into. And then what I learned was that the families were being required to work with, a central line. And for those that don't understand what that is basically like a line that goes through the heart. That in the state of New York, only a registered nurse in a medical facility is allowed to work with, but for me, when a family member was telling me that they were home working with this line just by somebody coming training them in a hospital for an hour, I
Hmm.
was just perplexed. Like, how does that make sense? How do you go from being in a hospital for months on end and then someone comes in, trains you, and then you're left with this responsibility for your immunocompromised? Now, let's be clear. When you
Mhm.
go through transplant, you have no immunity, nothing, like zero, worse than an AIDS patient.
Mhm.
Okay. So the fact that you're sending families home to work with this line with this immunocompromised person, it just did not sit right with me at all. And
Mhm.
we're not talking about people, patients that are going home and maybe getting 30 minutes or an hour of infusion. Dream left the hospital with 12 to 14 hours
Mhm.
of infusion. So that was what I was being expected to task with. And I just didn't make sense. Can we get, private duty nursing to go home to assist with this? And, I was met with, this is what you're required to do. That I was met with what I was requesting was an unrealistic expectation, quote unquote, and so then obviously having connection, started to reach out and ask, for assistance. So I contacted your office, Assemblywoman Sandy Galiff's office, and said, hey, this is the issue and this is what's going on. And, because you guys were able to help and intervene, that to me changed the narrative with how we were able to get assistance for Dream to go home to get private duty. But even when they sent us home, the insurance company kept saying, we're going to give you this for 30 days, only with the expectation until mother is willing or able to learn.
Mhm.
And and I would get these, letters every 30 days. And until ultimately, I think Dream had ended up intubated in the ICU. And then she had went up to, I think, as far as up to 18 hours of
Mhm.
nursing. And then that's when I stopped getting letters about nursing. But it's like it took all of that for you to
Mhm.
then, understand that this is what was needed to keep her healthy. And then, all of the challenges like, for instance, we had, even when we had nursing, we had a nurse from the one of the infusion companies that was training one of her nurses on what to do, and ended up breaking her line, right?
Wow.
Simply by not unclamping it. Now, this is a medical professional who's done this many, many years. And even I know, like, unclamping a line is like 101.
Hmm.
So can you imagine the burden we put on families who are already in a difficult situation to then go home, become nurses, and be responsible for 12 to 18 hours of nursing, and then you
Right.
still have nurses that are making simple mistakes. So I'm just, I know no one's perfect, but it's
Hmm.
like, I just feel like that was never a responsibility any family should have to take on. We're not talking about, someone who's not, immunocompromised. We're talking about medically fragile people that
Right.
really need the assistance. So, listen, as soon as Dream's line came out, there were no nurses needed. But in the time that she was critical, it was needed.
And in preparing for Dream's Law, I remember doing research and seeing the amount of infections that are caused from a central line, and how that happens in the best of circumstances where you have trained professionals, but where you have non-trained personnel, caregivers, the infection rate goes up tremendously. And these are not just minor infections. We're talking about serious blood infection, where you're talking about the fatality rates being extremely high. And I don't remember the exact number, but I remember it being like tens of thousands of people die every year from the infection from a central line. So to me, it's one of those things. It's just a lack of common sense where bureaucracy just rules the day, and putting the profits before people, like is often done, unfortunately, with these insurance companies. And this was just so egregious. So I'm glad that we were able to finally pass Dreams Law, and I'm hopeful that it will provide help to people, because when we talk about transplants, it's a whole process, like you talked about a little bit today, that it you have the operation, which is a big deal, of course, but there is some recovery depending on what type of procedure it is. And also, when we talk about transplants, we often stem cell is something that's not talked about a lot. And I wanted to ask you about that in terms of you were the donor for Dream. What was that like in terms of being an intensive process? What was that like for you?
Um, it was interesting because for me, I got to kind of walk in my daughter's shoes a little bit, and it's interesting that we're having this conversation because she and I were just talking about that.
Mhm.
I was like, because when I came out of, I had to get a line as well,
Okay.
and I told her I remember freaking out on the table because like they had like it was all covered and all I could hear was people over my head, and my heart rate started going up, and the nurse was like, "What's happening?" And I was like, "I'm too nervous. You have to tell me what's going on." I like to control a lot, so
Yeah.
it was, so I was very humble coming out of that for my daughter, and I said I only could imagine what you go through from all of the things that you've gone through, and having to be in a space where you have to be trusting of people, and just so I gave my hats off to her, because I even in that one moment was still a lot for me. And
Mm.
but it was, I was nervous in some ways, but as a mother, there's nothing that I wouldn't do. So whatever little bit of nervousness was there, my mother had, definitely
Sure.
overcame that. And, I had to inject myself with Neupogen to build up my own stem cells so that
Hmm.
way they extracted from me. So I had to do that for a week, and then I went into a procedure, and then for like 2 days I was like connected all day to like this multi-million-dollar machine that extracted my stem cells. Dream didn't have to go through surgery, like it was infused.
What was the recovery like for you, being the donor?
um the recovery was I was like sore for a little
Hmm.
bit, but obviously I don't even, I was sore like even when I had to inject myself with the Neupogen,
Hmm.
for that, I was achy, they were like, oh, do you want any medication? And I just I didn't want anything extra. I wanted to experience the whole experience, you know the best I could, because there's nothing in comparison to me, to what Dream had to go through.
Hmm.
So I wanted to feel every moment of it, and just sitting, and even when I was connected to the machine for 2 days, just sitting all of my good intentions, thoughts as they were extracting. I did a lot of meditation with, it was just me and a nurse in the room. All you just, she's just taking these things, and then they take it. Then I guess they process it, however they process it through the blood bank, and then they freeze it until they're ready to um, give the infusion to the person that is receiving it. So.
Well, it's very interesting, and I really appreciate you sharing that with us, because it gives some insight into the process, and it's something that's is so important in that awareness, and like you talked about in the beginning about being educated and then educating people about the issue, and that's, I think, the biggest thing. I was talking to Lauren Shields, who I worked with to do Lauren's Law, about building up the registry so we get more people in New York to donate and to be organ donors. And just that we were talking about the advocacy, that it took a long time to get that law passed, like Dream's Law. But a
Mhm.
big part of it is talking about the process and getting people to think about, okay, maybe they hadn't thought about organ donation and now they're thinking about it, or they
Mhm.
never thought about sickle cell and how that impacts, or even that you can be a stem cell donor
Mhm.
and the living donor portion of all of this. How with new technology and medicine that it's becoming more accessible than it was before.
Mhm.
But we got to make sure that the policies are in place to continue to make it a priority. That not only is insurance covering it, but we're
Mhm.
continuing to invest in innovation, research and development in these areas.
And I also wanted just to add, which is
Please.
very big for African Americans. We have got to become donors.
Mm,
We have to become blood donors, organ donors. There's not enough of us. Really have got to get out and start um, donating, because that's also a big reason why it's important for them to come up with a study like a haploidentical stem cell transplant, where someone like me can donate to their own child. But there's a possibility somewhere that someone could have been a perfect match, but
right.
that's because we don't have the banks to support it. So to me, one of the biggest messaging through this month, that when we're talking about, as we're having all these conversations about racial disparities,
Mm,
one of the things that we really have to key in on in this conversation with minorities is that we have got to donate.
mm.
That is
It-
important.
It's so important. It's so important because, like we talked about, that you could have found a perfect match,
Hmm.
where it be it worked out in Dream's situation, but it
Hmm.
could have been even an easier process. But
Right.
And you have the modern medicine, you have these breakthroughs, but if we don't have people signing up to be donors, then we're not going to be able to fulfill these opportunities. And that's what
Right.
in New York we're seeing the rate grow, but it's something that we have to continue to push and fight and, like you said, educate people.
Anybody who, had a moment to listen to this and, feels inspired to, donate, do it.
Mm,
Do it.
yeah.
Bless someone else, even if you don't know who they are.
How's Dream doing now?
Dream right now, we found out at the beginning, the end of 2019, it was diagnosed with osteosarcoma. So for the past for this year, we have been battling that.
Mm,
However, she is 3 treatments away of being able to ring the bell on that. And it has been a journey, but, she is a warrior. She is about to turn 16. I know that she has great things to do in her future. And, this is all about her testimony and how she's overcome and how she not has just changed things for herself, but for the world.
yeah.
So, she's fighting, and she's, one day at a time.
Good. Well, please give her my regards and let her know that I'm thinking about her and wish her a happy birthday as well. And I really appreciate you spending the time with me today and just really appreciate all the work that you've done on this issue and many other issues as well. But your tenacity and persistence has really helped Dream, obviously, but has helped so many other people because going through some of these really challenging times for you and your family and sharing that with others and making sure that, no, it doesn't have to happen again. That's made a real impact and a real difference.
Thank you for listening to Senator Carlucci's interview. Today is Organ Donor Enrollment Day, a day dedicated to inspiring New Yorkers just like you to sign up as an organ donor. To become an organ donor, please visit the link on your screen or visit Senator Carlucci's Facebook page.